everyone. August is National Psoriasis Month. We thought to do a quick sort of overview on what psoriasis is. We do have a longer video that is a replay of a live stream with my mother, who is a dermatologist and dermatopathologist and works with psoriasis patients a lot. But this might be a nice sort of intro, and then you can get more information also at vmvinskin.com. A great article on it there. Psoriasis is basically characterized by thick, red, scaly patches on the skin, on the nails, nail beds, and possibly on the scalp. It can be different for different people. Within psoriasis, the world of psoriasis, there are also different types of psoriasis, plaque psoriasis and whatnot. So it is definitely the first thing to share and to really sort of nail home is psoriasis is not something to self-diagnose or to self-medicate. It's an immunologic condition. And in that sense, it's sort of like an allergy. It's sort of like atopic dermatitis or contact dermatitis, um, but it does need management with a dermatologist. So it is not something to self-diagnose. It is commonly mistaken for many other skin conditions. It's hard to diagnose. It is important to see a specialist. And what your doctor might do, in addition to just an ocular inspection of your skin, they might take a biopsy. They might also ask for certain blood tests. It can affect 10% of the body, sometimes more, and it's measured by PASI. And because it is an inflammatory condition, you don't care for psoriasis as just one thing. You really have to look at the patient in their entirety, right? So you would be looking for comorbidities, diabetes, obesity, rheumatoid arthritis, depression, other things that are related to inflammation. And so when caring for someone with psoriasis, some really effective, wonderful things are drugs called biologicals, which can be expensive, but can also be covered by your insurance. And they can be really dramatic at clearing psoriasis for many months at a time, up to like a full year or so. But also, you want to get a patch test because contact dermatitis frequently coexists with psoriasis, and you don't want to trigger a flare. A really good way to not trigger a flare is by avoiding your allergens. So a patch test is really important as well. And other things that are anti-inflammatory. So many times there have to be lifestyle changes, really increasing your anti-inflammatory foods and decreasing pro-inflammatory foods like junk food, basically. Um, and then definitely watching your sleep, making sure you get a lot of sleep because sleep deprivation is pro-inflammatory, and exercise and all these other really healthy things. And of course, the regular monitoring of inflammatory markers. Other possible comorbidities, hypertension, and certain infections. So especially when you're on biologicals and stuff, your doctor will be monitoring you for things like tuberculosis, et cetera. So you do need to disclose that you have psoriasis when you're seeing other health specialists, other doctors, and tell them what medications you might be on. Top thing to share is if you have psoriasis and you've been managing it for many years with topical steroids, it might be time to get off them. Topical steroids are really dramatic, wonderful, important drugs, and they're usually prescribed for a short amount of time, sort of like, an emergency thing for up to maybe 2 weeks or so. Longer than that, there are many health problems associated with topical steroid use that can lead to really severe health problems. And when coming off of steroids, you can have a rebound effect or steroid withdrawal that sometimes requires hospitalization. It's a thing. So if you can limit your topical steroid use to once or twice a year, that's great. And key ways to do that is approaching it holistically, right? Look at biologicals, ask your dermatologist about that, get your patch test so you can avoid your triggers, and practice an anti-inflammatory lifestyle so you can keep calm, prevent, triggers, prevent flares. And that's kind of it. Sort of the main things, I guess, to share here. And again, you can get more information on YouTube, on our channel. And there are global organizations on psoriasis are really important. I'll put the links in the description later, and our article on psoriasis in InSkin. But the first thing is don't self-diagnose, don't self-manage, don't think it's a one-pill miracle treatment you're going to need. It's a holistic treatment that might include biologicals as well as patch test to avoid your allergens, and then keeping everything very anti-inflammatory and gentle an allergen-free cleanser, moisturizer, barrier repair, like our any of our moisturizers followed by virgin coconut oil, then Boo Boo Balm, for example, is great. Reaching for something like our Calm the Heck Down Balm before topical steroids. Definitely getting off of the topical steroids, and we have videos and in-skin articles on that as well. And yeah, caring for yourself entirely. So, stress management, eating anti-inflammatory foods, getting enough sleep, all that good stuff, looking out for your health and managing your psoriasis with your dermatologist so that they can manage the comorbidities that can coexist with it. Lastly, I'm going to leave you with it can look a little shocking when you're in full flare, but it is not contagious. And so, if you know someone with psoriasis, be part of the solution and show kindness and be a great support system for that person. So there, an anti-inflammatory lifestyle is probably good for everyone in the age of such high stress anyway. So be well, take care of each other. Bye.